Normally, if the circadian rhythm or cycle is respected, we are going to sleep at a certain hour or hours day by day. But if you have disorder like narcolepsy, it can be accompanied by decreased muscle tone, decreased mood, increased desire and need to sleep, and it can be at any hour, at any time. Let's discuss this step by step. Narcolepsy is a chronic sleep disorder which is characterized by overwhelming daytime drowsiness. So it is at a daytime which is not normally, and sudden attacks for sleep or of sleep. People with narcolepsy often find it difficult to stay awake for a long time period of time, regardless of the circumstances. Pathogenesis, hypocretin 1 deficiency in narcolepsy type 1 patients drives daytime sleepiness, cataplexy, sleep palsy, sleep fragmentation, hallucinations, and autonomic changes. However, hypocretin 1 can also influence the olfactory system for two different pathways. It can be detected in olfactory nuclei, brain cortex, tonsils, and nasal mucosa. The olfactory system should be modulated through hypocretin 1 via connections from the hypothalamus to other brain organs, as hypothalamus is responsible for a sleep cycle. Narcolepsy can be accompanied by a sudden loss of tone, which is called cataplexy, which can be triggered by strong emotion. Narcolepsy that occur with cataplexy is called type 1, and without type 2 narcolepsy. So sudden loss of muscle tone, if it is present, is called type 1, is absent is type 2. Let's talk about symptoms like excessive daytime sleepiness. People with narcolepsy fall asleep without warning, anywhere, anytime, and during the day especially. Sudden loss of muscle tone, this condition called cataplexy, can cause a number of physical changes like slurred speech to complete weakness of most muscle of the body, may last up to a few minutes. Cataplexy is uncontrollable and is triggered by intense emotions, usually positive ones, such as laughter or excitement, but sometimes fear, surprise, or anger. Sleep paralysis. People with narcolepsy often experience a temporary inability to move or speak while falling asleep or upon waking. These episodes are usually brief, lasting a few seconds or minutes, but can be frightening. Most of the symptoms lasting for a few minutes. Changing in a rapid eye movement or REM sleep phase is typically when most dreams happens. REM sleep can occur at any time of the day in people with narcolepsy. People with narcolepsy often transition quickly to REM sleep, usually within 15 minutes of falling asleep. Hallucinations, call it hypnagogic hallucinations if they happen as people falling asleep, and hypnopumping hallucinations. Gogic like going to sleep, and pumping like pumping from the bed or awakening. An example is feeling as if there is a stranger in patient bedroom. These hallucinations may be particularly vivid and frightening because patient may not be fully asleep when begin dreaming or experience dreams as reality. What are the causes of narcolepsy? The exact cause of narcolepsy is unknown, of course. People with type 1 narcolepsy have low level of chemical hypocretin, so low level of hypocretin. Hypocretin levels are particularly low in those who experience cataplexy, and exactly what causes the loss of hypocretin production isn't known. Of course, autoimmune reaction or autoimmune stasis is not excluded. It's also likely that genetics play a role in the development of the narcolepsy. Research also indicates a possible association with exposure to the swine flu or H1N1 flu virus and a certain form of H1N1 vaccine that's currently administered in Europe. Though it's not yet clearly why. Also, a new version can appear as COVID-19 can also declare or indicate a possible cause of the narcolepsy. How do you diagnose narcolepsy? Sleep history, sleep records, polysomnography, and multiple sleep latency tests. So a part of the history involves filling out the Epworth Sleepiness Scale, which uses a series of short questions to gauge degree of sleepiness. So you are assessing how deep is the sleep and if patient can be awakening right now. Sleep records, like patient may be asked to keep a detailed diary of his or her sleep pattern for a week or two, so a doctor can compare and the level of alertness and pattern of sleep. These records can be made by people who living with a patient, for example, wife or husband or children. Polysomnography. This test measures a variety of signals during sleep, using electrodes placed on the scalp. For this test, patients must spend a night at a medical facility and be investigated. The test measures electroencephalographic activity or EEG and heart electrocardiogram, electromyogram or EMG, and movement of the eyes or EOG. Multiple sleep latency test. This examination measures how long it takes to fall asleep during the day. People who have narcolepsy fall asleep easily and enter into rapid eye movement sleep quickly. Does exist any of the treatment for narcolepsy? Of course, there are many types of medications like stimulants, modafinil or armodafinil, which are first line for narcolepsy. They are stimulants and don't produce the highs and lows often associated with older stimulants, so modafinil and armodafinil. Sunosi or solriamfetol and pitolisant or wakings are new stimulants used for narcolepsy, headache, and anxiety. Some people need treatment with methylphenidate or various amphetamines. These medications are very effective but can be addictive. They may cause side effects such as nervousness and heart palpitations. SSRIs or selective serotonin reuptake inhibitors and SNRIs or serotonin and norepinephrine reuptake inhibitors. They help alleviate the symptoms of cataplexy, hypnagogic hallucinations, and sleep paralysis. Fluoxetine, paroxetine, and venlafaxine. Side effects are weight gain, insomnia, and digestive problems as they increasing serotonin level, which act as stimulant and of course gastrointestinal stimulant of the peristalsis. Tricyclic antidepressants. These older antidepressants such as protriptyline, imipramine, and clomipramine are effective for cataplexy and many other diseases, but many people complain of side effects such as dry mouth and lightheadedness. Sodium oxybate or XRM. This medication is highly effective for cataplexy. It helps to improve nighttime sleep, which is often poor in narcolepsy as patient is sleeping during the day. In high doses, it may also control daytime sleepiness. And XRM or the same can have side effects like nausea, bedwetting as you are not awaking during the sleep, worsening of sleepwalking. Taking sodium oxybate together with other sleeping medications Narcotic pain relievers or alcohol can lead to difficulty breathing, coma, and death even. Thank you very much for your attention. Hope this video is useful. Have a great time.